Hello, everybody. I am Rima Stanley, tutor at M College of Nursing, Department of Mental Health. In this video, I'll be discussing with you about nursing care of patient with delirium. Delirium is a serious disturbance in mental abilities that results in confused thinking and reduced awareness of the environment. The start of delirium is usually rapid within hours or a few days. Let us see the definition of delirium. Delirium is an acute organic mental disorder which is characterized by impairment of consciousness, disorientation, disturbances in perception, and restlessness. Looking into the incidence, delirium is seen about 10 to 25% of medical surgical inpatients and about 20 to 40% of geriatric patients meets the criteria for delirium during hospitalization. Now, let us see the risk factors for delirium. Any conditions that results in a hospital stay, especially in intensive care unit or after surgery, increases the risk of delirium, as does being an inpatient in nursing home. Delirium is also more common in older adults. Examples of other conditions that increases the risk of delirium include brain disorders such as dementia, stroke, Parkinson's disease, previous delirium episodes, visual or hearing impairment, the presence of multiple medical problems. Now, let us see the etiology for delirium. Delirium can often be traced to one or more contributing factors such as severe or chronic illness, changes in metabolic balance such as low sodium, certain medications, infections, surgery, alcohol, drug intoxication, or withdrawal. Here are some of the causes of delirium. Vascular causes such as hypertensive encephalopathy, intracranial hemorrhage, infections mainly encephalitis and meningitis, neoplastic conditions such as space occupying lesions, intoxication, mainly chronic intoxication or withdrawal effect of sedative hypnotic drugs, trauma of head and neck, subdural and epidural hematoma, contusion, lacerations, vitamin deficiencies, mainly thiamine and vitamin B12, endocrine and metabolic conditions such as diabetic coma, shock, uremia, myxedemia, hyperthyroidism, and hepatic failure. Heavy metals, for example, lead, manganese, mercury, carbon monoxide, and toxins. Anoxic state, mainly anemia, pulmonary or cardiac failures. Several medications or combinations of drugs can also trigger delirium, including some types of analgesics, sedatives, Parkinson's drug, and antipsychotics. Severe and chronic terminal illness can also lead to delirium. And in case of children, fever and infection. Certain medical conditions such as stroke, heart attack, worsening of lung or liver disease, etc. Now let us see the clinical features of delirium. The signs and symptoms of delirium usually begins over a few hours or a few days. They often fluctuate throughout the day and there may be periods of no symptoms. Symptoms tend to be worse during the night when it's dark and things look less familiar. Primary signs and symptoms include this below: impairment of consciousness, that is, clouding of consciousness ranging from drowsiness to stupor and coma, impairment of attention, that is, difficulty in shifting, focusing, and sustaining attention, perceptual disturbances such as illusion and hallucination, most often visual hallucination, where hallucination means seeing things that does not exist, and illusion means misinterpretations of external stimuli. Disturbance of cognition, mainly impairment of abstract thinking and comprehension. Also, there is an impairment of immediate and recent memory. Psychomotor disturbances, it may be either hypo or hyperactivity, flocculation, that is aimless grouping or picking at the bedclothes, disturbances of sleep-wake cycle, insomnia or in severe cases, total sleep loss may be seen, reversal of sleep-wake cycle, daytime drowsiness, nocturnal worsening of symptoms, disturbing dreams or nightmares which may continue as hallucination after awakening. Emotional disturbances such as depression, anxiety, fear, irritability, euphoria, and apathy is also seen in patients with delirium. Now let us see the types of delirium. Experts have identified three types of delirium. They are hyperactive delirium, hypoactive delirium, and mixed delirium. Hyperactive delirium is the most easily recognized type. This may include restlessness, example pacing, agitation, rapid mood changes, or hallucination and refusal to cooperate with care. Hypoactive delirium. This may include inactivity or reduced motor activity, sluggishness, abnormal drowsiness, or seeming to be in daze. While mixed delirium, this includes both hyperactive and hypoactive signs and symptoms. The person may quickly switch back and forth from hyperactive to hypoactive states. Now let us see the nursing intervention for patients with delirium. First and foremost, providing safe environment. Restrict the environmental stimuli and keep the unit calm and well lighted. There should always be somebody at the patient's bedside reassuring and supporting. As the patient is responding to a terrifying and realistic world of hallucinatory illusions and delusions, special precautions are needed to protect him from himself and to protect others. This can be done by using side rails to prevent falls and restraining the patient whenever necessary. Elevating the patient's fear and anxiety. Remove any objects in the room that seems to be a source of misinterpretation. As much as possible, have the same person all the time by the patient's bedside. Keep the room well lighted, especially at night. Interventions in meeting physical needs of the patient. An appropriate care should be provided after a thorough physical assessment. Use appropriate nursing measures to reduce high fever if present. Maintain the intake and output chart for the patient. Mouth and skin care should be provided for the patient with delirium. Monitor the vital signs and observe the patient for any extreme drowsiness and sleep, as this may be an indication that the patient is sleeping into a coma. Now let us see the intervention in facilitating orientation and to help patients remain calm. This includes such as providing a clock and calendar and refer to them regularly throughout the day. Communicate simply about any change in activity such as time for lunch or time for bed. Keep familiar and favorite objects and pictures around, but avoid a clustered environment as this will increase the patient's anxiety. Approach the patient calmly. Identify yourself or other people regularly by introducing yourself and others with name. Avoid arguments. as this will increase the patient's anxiety. Use comfort measures such as reassuring touch whenever appropriate. Minimize noise levels and other distractions. Provide and maintain eyeglasses and hearing aids if necessary. Now let us see interventions to promote good sleep habit. It is important to provide a calm and quiet environment while the patient is sleeping. Keep the inside lighting appropriate for the time of the day. Plan for uninterrupted periods of sleep during the night. Also help the person to keep a regular daytime schedule. Encourage self-care and activities during the day. Interventions in preventing complications. Give the persons proper medication on a regular schedule. Provide plenty of fluids and a healthy diet. Also encourage the patient for regular physical activity. Get a prompt treatment for potential problems such as infections or metabolic imbalances. Caring for caregivers. You may consider joining the caregivers in a support group. Also teach the caregiver about the patient's conditions and the recovery on or prognosis. If possible, give educational materials or other resources so that the patient's caregiver will have a better understanding about the illness. Advise the caregiver to share caregiving with other family members or friends who are familiar to the person so that the primary caregiver can have a break. Here are some of the examples of organizations that may provide helpful information. This include the Caregiver Action Network, the National Institute on Aging. Now let us see the difference between delirium and dementia. Delirium and dementia may be difficult to distinguish, and a person may have both. In fact, delirium frequently occurs in a person with dementia. But having episodes of delirium does not always mean a person has dementia. So, dementia assessment should not be done during a delirium episode because the results could be misleading. Dementia is a progressive decline of memory and other thinking skills due to the gradual dysfunction and the loss of brain cells. Some differences between the symptoms of delirium and dementia include the onset, duration, attention, fluctuations of symptoms, causes, communication abilities, and activity level. The onset. The onset of delirium usually occurs within a short time, while dementia usually begins with relatively minor symptoms that gradually worsens over time. Duration of the illness. Dementia is generally a chronic, progressive disease that is not curable, although there are some reversible causes of dementia symptoms such as vitamin B12 deficiency, normal pressure hydrocephalus, thyroid dysfunctions, whereas delirium can last for a couple of days to even months. Delirium is almost always temporary if the cause is identified and treated. Attention. The ability to stay focused or maintain attention is significantly impaired with delirium. A person in the early stages of dementia remains generally alert. Fluctuations of symptoms. The appearance of delirium symptoms can fluctuate significantly and frequently throughout the day. While people with dementia have better and worse times of the day, their memory and thinking skills stay at a fairly constant level during the course of the day. Causes of the illness. Delirium is typically caused by an acute illness or drug toxicity, sometimes which is life-threatening but is often reversible. Dementia is typically caused by anatomic changes in the brain and has slower onset and is generally irreversible. Communication abilities. In delirium, there is impairment in the ability to speak coherently or appropriately, while people with dementia have difficulty finding the right words, and the ability to express themselves gradually deteriorates as the disease progresses. Activity level. People with delirium are often either overly active, between hyper and restlessness, or underactive, that is lethargic and less responsive compared to the usual functioning. However, dementia tends to not affect a person's activity level until the later stage. So in this video, we have seen nursing care of patient with delirium, and also we have seen the differences between delirium and dementia.